So welcome back to Breaking Dawn this morning. And as we return, we're 17 minutes past the hour of 8 o'clock. And for the next 10 minutes, we're going to be chatting with Chetwayo aboard and the Holistic Health Clinic. And we're going to be talking about psoriasis. So we got Seth via Zoom. We're going to bring him in immediately. Morning, Seth. What's up, man? I like how the beard grew back out full, man. The beard grew back. No, this is the Seth that I know. All right? Nice, man.
And this is under a year's length. You said that, was about a 2-year beard.
A 2-year beard. But it's starting to look familiar now. So, so psoriasis is the issue.
All right, psoriasis.
Tell us about it.
All right, so psoriasis. Now, psoriasis, when you look at psoriasis, I like to go back into the Greek meaning of the word. So when you go into the Greek meaning of the word, it means you have psora, which means itchy, and iasis, which means a condition or disease. So it's a itchy disease. All right, and we know it deals with the skin, so you have that itching of the skin taking place. So what I'm going to do here, let me share my screen.
Sure.
All right, so let's take a look at the condition here.
Right.
So here we have images of the skin. You have the normal skin, and then you have psoriasis. Now, psoriasis is said to be an autoimmune condition when your immune system starts to attack your skin cells.
Right.
Now, the response of the skin cells to being attacked is that it's going to grow. All right? So the skin cells would grow, but it's being attacked. So this is why you would have more growth, or what it is when you have rapid growth of your skin cells. But remember, the skin is being attacked, so then you're going to have damaged skin. So it's growing, but it's being damaged, or it's going to be inflamed because your immune system is attacking it. All right? So this here is, you see the two image, and you'll see the plaque on top here, which is the damaged skin. So this is why you'll get the red, the reddish color of the skin, and then you would have like the scaling, because the skin is growing fast, and also it's being damaged. So you get that scaling or kind of silverish looking kind of color on it.
Right.
All right? And it'll be flaky. It can be painful. It can be itching. All right? Not to just remind people that eczema and psoriasis are two different things, but they do have similarities, so it can be misdiagnosed one for the other. All right? Now, psoriasis, they say it's incurable. Of course, that's not true. It can be reversed.
Right.
All right? I would mention some connections and stuff with it in order to show that as we go along in the program. In fact, let me just change the image here to show us there are different types of psoriasis. So you see in types of psoriasis, have the plaque psoriasis, gutted psoriasis, pustular psoriasis, inverse psoriasis, nail psoriasis, and sporadic arthritis. All right. Now, I don't want to spend too much time going into all of these because we can't go into them, but we have to understand that psoriasis in general is your immune system attacking itself. And some people might be, as they might say, genetically predisposed, but then some environmental factor would have to trigger it. All right? Okay. Because you can have be genetically predisposed for something and never get it because you never encountered that environmental factor. Okay. All right? So what people need to look at is the environmental factor. Now, with a lot of people with psoriasis, or let's go to foreign countries, you get an increased amount of cases around, or flare-ups, because people would have flare-ups periodically with things like psoriasis. It cycles. But when it comes to winter time, you get flare-ups. And of course, we know in winter there's less sunlight. You also have things that can trigger it, like people that suffer with hypocalcemia, who have lowered calcium levels, right? So their calcium levels are low, so that can trigger a flare-up. And then you have certain medications that can also trigger a flare-up. So medications that deal with conditions like has to do with the cardiovascular system, so like heart medications, blood pressure medications, and so forth, especially in the lines of beta blockers, because you have like the calcium channel blockers, all right? Those things would flare it up. So, and this is why when I don't believe in medicating, I believe in dealing with root cause, because somebody with, if you have eczema and you mix up your eczema and think it's psoriasis and you take medication for psoriasis, it can worsen the eczema. And if you have psoriasis and you thought it was eczema and you take medication for eczema, it can worsen the psoriasis. This all just goes to show that medication do not deal with root cause, because why, if you take the wrong one, it's going to cause the other condition to get worse. Right? Yeah. And we have to get out of that mentality of looking to medicate and not addressing root cause. Now, let me close the screen here and let me talk to the people direct. When it comes to these conditions, all right, we have to understand when people are in winter conditions, which means lack of sunlight means a lack of vitamin D.
Okay.
Lack of vitamin D, for those that don't know, remember I mentioned earlier, hypocalcemia, so people have a calcium deficiency. That's also a trigger. Vitamin D and calcium goes together because vitamin D is like the key to unlock calcium absorption. So if you have a vitamin D deficiency, you automatically would have a calcium deficiency. So calcium is being affected. So in winter time where there's a lack of sunlight, you could get that issue. But we here in Trinidad, we don't have winter, and we have a lot of people with psoriasis, which means people are having the calcium deficiency. Now, I did some segments, I think it was a year or 2 years ago, when I was dealing with cancer and with skin cancer. And today we have the most amount of skin cancer cases in recorded history. But we also have, in recorded history, people getting the least amount of sun exposure. So we know that people aren't getting enough sunlight, right? But yet cancer cases are on the rise to show that, sunlight is not what actually causes skin cancer. There is another underlying factor that is not being looked at or addressed. And that has to do with cholesterol. Because cholesterol plays a very important role in the body's ability to convert UV B rays into vitamin D. So if you are not consuming enough dietary cholesterol, you would be in some problems with regards to your vitamin D, and therefore that would lead you to having calcium deficiencies. Then there are other foods that contain things like phytic and oxalic acid, which blocks calcium absorption. So these things block calcium absorption. So when your calcium is deficient, this can lead to triggering psoriasis. All right?
Okay.
Now, like I've said many times before, people don't need to know all of this information. This is why Chetwayo Holistic Health Clinic is available. I am sharing this information to give people a sense of confidence to understand that I actually know what I'm speaking about, right? You go by a clinic or a doctor or any healthcare professional, and they're simply going to put you on medication. Medication, and not address the root cause of the issues. If the root cause of the issue is not being addressed, your problem is going to persist, and you're going to have to constantly live off of medication. And like I mentioned earlier, these medications have negative side effects. So you're going to eventually develop other problems. In fact, some of those very same medications have been shown to cause liver disease. I mentioned, this was like 2 years ago, 3 years ago, I mentioned acetaminophen, which is main ingredient in over 600 over-the-counter drugs, like things like ibuprofen and paracetamol and so forth. And that is one of the medications used to treat these conditions, one of the drugs, active ingredient in these drugs. But it's also responsible, is the second leading cause for liver transplants. So it is always safer and better to deal with root cause than to medicate. Once you are constantly thinking that medication is the way to go, you are going to eventually run yourself into more and more problems. These skin conditions are fixable stuff, but you have to be willing to commit and make the necessary changes and stick to those changes. Because some of the issues I encounter is many people have been groomed or programmed to look for fast symptom suppression. Keep in mind, symptom suppression just suppresses the symptom, doesn't deal with root cause. So while you might get...
Go on today, coming back some other time,
Yeah, exactly. So while you might get some kind of temporary relief, today, the problem is going to come back. right? And we need to have a more long-term vision with regards to health. So there's something I tell people, and what I tell people is that short-term goals can lead to long-term calamities, right? And let me repeat that. Short-term goals, especially in regards to health, can lead to long-term calamities. We need to stop looking at, all right, I just want this thing to stop today, right?
Yeah.
And you don't care about tomorrow or the future, right? Because that could lead you down a road or a path where illnesses can get worse. I've had people contacted me, did consultation with me last year before, and they say, no, they ain't going to get onto my program, and then contact me this year and say, well, they want to find out about getting onto my program because their condition has worsened to the point now of it developing into cancer, right? When they came to me before, there was no cancer, and I did warn, if you don't make the changes, this is what is going to happen.
This is what it could
but
lead
you know,
to,
a lot of people like the quick fix, the quick temporary fixes, and that is what they go for. Many people are impatient with regards to their health and themselves. We have spent decades damaging our health. You could spend a little bit of time trying to fix it, right? And I think that is what people need to do.
All right. Just a couple things here before we wrap up. What you think of? I'm going to ask you a political question here.
Go ahead.
And then I'm going to ask you a question relating to something that you said a little earlier. As a matter of fact, let me start here. You said lack of calcium, right?
Yeah.
All right. Most people, when they hear calcium deficiency, they think milk. Well, I need to drink more milk.
Right.
But
right.
then my understanding is that adults don't need milk. You drink milk when you're a baby and when you develop into an adult or a big child, you no longer require drinking milk. But when you have calcium, you immediately think milk. Like that's the first thing comes to my head. So where do you get the calcium from, if not milk?
Right. There are many sources of calcium, simple things like bones, right? The soft part of bones that people love to eat, right? You're getting calcium from there. In fish, the soft bones in fish that people also eat, you're getting calcium of there. There's trace amount of calcium in eggs and stuff. Even egg shells, there are some people that would even use the egg shells, dry it, and might crush it and sprinkle it on what they're going to eat as well. So cheese also a source of calcium as well. Now when it comes to milk, humans are the only mammals that consume milk after the weaning stage of life, and we don't even consume our own milk, because all mammals discontinue the production of milk. And that has, it's called the weaning stage for a reason. Weaning means to wean off of milk, right?
Right.
So you wean off of the milk. All mammals in nature discontinue the consumption of milk after the weaning stage. What a lot of people don't know is when humans consume milk, especially milk from other animals like cow's milk, I think I mentioned before that cow's milk is too potent for the human digestive system and it causes intestinal bleeding. All right, this is why a lot of children are anemic from consuming cow's milk. So milk is not a good source. From studies that have been done, it says for every glass of milk somebody consumes per day, like if somebody is drinking 1 glass of milk or 2 glasses of milk, for every glass of milk, it reduces your life expectancy by 15%, right? So people need to stay away from it. Keeping in mind, milk has sugar, all right? Milk has sugar. And getting in that excess sugar beyond the weaning stage of life compromises the integrity of the body.
Of the body, yeah.
Right? And most people loses the lactate enzymes and are unable to separate the glucose from the galactose in the sugar. And that there, the body can't absorb that, so it ends up in your colon fermenting and stuff. And this is what we will call lactose intolerant. This is why people would end up with diarrhea, constipation, or what you call it, bloating, and abdominal pain and so forth, lactose intolerance. That is why you get that. You are not weird if you suffer from lactose intolerance. The weird person is the person that don't suffer from lactose intolerance, right? So they would say that they are lactate persistent, right? Because they are holding on to an enzyme that the body is supposed to let go of, all right? Which also means that it will just absorb more sugar from milk, which is also not a good thing, all right? So when it comes to that, people need to stay away from it.
Right.
But we have been groomed to consume it because it is tasty. And one of the reasons, apart from it being as tasty as it is, because they put in added sugar as well. They put in extra sugar. Now, some people will say, well, I just drink it straight from the cow, but you are not a cow. Right? And we need to understand that. Right? We need to understand that it's made for specific animals. Yeah.
And final question here, if you could address this quickly before I run out of time. Robert F. Kennedy, right? I had somebody calling and he said that he's a crazy guy in terms of health and medicine and that kind of thing. But he has been consistently talking about a lot of the foods that the FDA pass that contain certain chemicals in it that are poisoning people on a daily basis. I think it's a pretty good, it's an excellent discussion that he has started. It's a terrific initiative. We'll see how the Trump administration deals with that. But you're saying, you know, a lot of the stuff that our FDA passes contains chemicals that are not allowed in those same products outside of the United States of America. And he's been talking about, you know, all these things that poison. He particularly pointed out, I saw an ad that he did, or a promo, where he had boxes of cereal. And we have spoken about that, right?
Yeah.
But let me ask you something. Do you think he's on the right track to a certain extent, and do you think that this is going to bring a serious shake-up where the FDA is concerned and, of course, Big Pharma?
Not really. Reason being, there are things that are approved because those things are less harmful than things that people would naturally produce and consume.
Right.
Right? So while he might be highlighting the toxins in these highly processed foods, there are natural foods that people consume that are thousands of times more toxic. Now, if we look to ban the more toxic stuff, you're going to see rioting in the streets, right? So the FDA would allow these things that are less toxic than some natural things because based on the data, it is, right? Though it might be harmful at certain doses, yes, right? Or if you get it accumulative on a regular basis, it is not as harmful as a lot of things that people naturally consume, right?
Okay.
So I see it as it might be it's a good initiative so you get people more aware, and cutting out some toxins is better than cutting out no toxins.
No toxins at all.
But you're still getting in a lot of toxins.
Okay.
And what I address all toxins, whether it's from processed or natural. I educate people on all of them. Because we have a bias where we believe everything that is man-made is worse than everything that is in nature. Right? That's the belief that people have. But that is not true. And because we have that bias, most people don't even look at anything from nature to look for dangers in them. So we have our guards down when it comes to nature, but when it comes to man-made products, our guards are sky high. Based on the scientific data, we consume 10,000 times more natural pesticides than man-made pesticides. 10,000 times, right? Okay. So while Robert Kennedy, what he's doing is it might bring some awareness to some pesticide, it is barely going to have any dent, even if they do make changes to these chemicals, barely going to have any dent on health, right? Because it's not addressing the main causes.
All right, people. So I'll tell you what, you can check out Chetwayo board, and of course you can book your consultation today, 761-1952. That is 761-1952 or 279-3935. Those are the numbers you'll get him on. make sure, give him a call, book that consultation and get the conversation.